Hi Matt, I'd like to walk you through some of the changes in the proposed outline that I have for our Intro to Pharmacology specific to the cardiovascular medications section that will be in the overall pharmacy board certification course. So to start, I do have a mock-up in D2L Brightspace, which is what we'll be transitioning to. But before we get through that mock-up, I just want to go over the course outline that I have proposed really quickly. So we'll begin with a welcome module, which will have an intro to the course and show the materials and kind of the layout. It'll have a course outline of all the different modules listed below, and that they should complete it in the order because it goes from probably the most common that they would see on the inpatient or outpatient side as pharmacy technicians, and then work their way through other ones. And then we'll just do, in the intro section, a general overall cardiovascular pathophysiology to get the students more engaged and have that baseline understanding. And then each one after that, for you can see hypertension and heart failure, there is a small just one slide each section on what it is, so they can understand what the medications are doing as they move forward, just to have that basic knowledge to really hone in and pass that exam in the medication section, which is the goal of this course. And so they will be on the D2L Brightspace. As you know, it's asynchronous. They will just have to have the internet connection and log in to D2L Brightspace to be able to access all this content. It will be embedded in the main content of the lesson and articulate storyline. And then for their note-taking process, they'll have drug tables, patient cases, and then study tools, which you had mentioned had already worked well, being a Quizlet. And then I've also proposed that there's a discussion board for any questions that either you can answer, or if one of their classmates is understanding and able to answer, to engage discussion as well, especially because students are all over the U.S. as well. And then assessment-wise, I know that we have the test at the end of the course and then the exam, but within each module, I'd like to use patient cases so they can really understand how the knowledge they're supposed to get is applied and why it might be useful, so they can help connect the dots, and I'll show that here. So let's get into the sample module. So this is the home content page. And as discussed, there's the overview, but let's look at this first module 1. And as I explained on the outline slide, they will have a lesson that they have to complete, and then for references, they will have a drug table, patient case, the study tool of Quizlet, and then the Ask the Class discussion. And you can also use this, I foresee, forum to engage on your every Thursday class that you meet and do skills-based things. And you could use this as the first 15 to 30 minutes, kind of discussing some questions that they might have. So if we were to click this, it would take us to, for now, it's just the review, but it would be an embedded articulate storyline lesson. And what it looks like is similar. We're using the Mayo slides to keep on Mayo branding. Here's an example of the short, the next two slides are the short pathophysiology. And then what we get into is, if we move down, this is going to be exactly what each slide is. So there will be, let's go back up here, sorry. And again, we'll fix formatting, but we'll have the mechanism of action and examples, the key side effects, the key warnings, and key drug interactions that they have to know. And then we'll go into the dosing formulation. And these would be the exact same that they have if we go back here and click drug table. This will be the exact same, so they can take notes on this, because although not completed in the review for you, after you approve the material, I will go back in and do voiceovers that will have some more information and talk through what's important. So the students will get these slides to take notes as they move through the lesson. In addition, at the end of the lesson, if we scroll down to the very back, which is the patient case, they have this example. They have patient cases, which they could click, go back here, sorry. So if you go down here, there are patient cases, which are the exact same, which if clicked will download this Word document so they can take notes as we move through. And you'll actually see here, if the student gets it right, they actually get feedback and why the other answers are incorrect. And it's only a 1 attempt per one, so it's set up. If they get it wrong, they will get feedback of it being incorrect and an explanation of why it's incorrect and what the correct answer is, so they can take notes on their the case file. And then finally, after they complete the lesson and move through the cases, which would be our kind of initial formative feedback that you can get a report from, they can study this, and then we also have the additional discussion questions for us to gauge, for you to gauge, excuse me, Matt, how well this new system is working and how well the students are retaining the information. And so I have done it purposely this way and broken up cardiovascular into these 6 modules, as you can see here, to really chunk the content into what classes of medications are grouped based on indication. There's always going to be some overlap, but just to help break it out for the students. And that way they can link it a lot easier together and make these, because almost all of our antihypertensives, the mechanism and purpose is to relax the blood vessel or expand it, whereas our dyslipidemia medications, that's going to follow the exact same layout. It's going to be reducing our cholesterol, so everything is around that. Antiarrhythmics is going to make our heart conductions go smoother and has the exact same layout. The antiplatelets and anticoagulants are the only one that's slightly different, just because the mechanism of antiplatelet and anticoagulants are slightly different. The lesson, drug table, and patient cases are broken out into 2 submodules, or 2 lessons. And then we have the cardiovascular tool and the Ask the Class at the very bottom of this particular lesson, with the goal being that they get inpatient, outpatient, maybe some specialty, and everything in between, so they are prepared for whatever avenue of work they go into being a pharmacy technician. And the goal with each lesson is to have all of the text that they would need in an easy, readable format that is chunked together based on, as mentioned, indication and then class of medication, so that cognitive overload, they don't have to switch back and forth. And then finally, there'll be voiceover to help support that information, help them know how to pronounce medications. Even me as a pharmacist, sometimes I look at a new drug, I'm like, I don't know how to say that. So hopefully this will get our learners that come in with a little baseline knowledge to be a little more comfortable with this and not have to worry about that barrier, as well as just give them practice in being able to say when they're quizzing themselves on their own or things of that nature. And then finally, we will wrap the course up with covering all topics reviewed and have a sort of checklist for them, highlighting our top medications that they have to know, the top 200 to 250. We'll have the drug tables, a reference for all of them there. And we'll have the last Quizlets and the study board question again for them to review if they need it. And with that, I look forward to your feedback on this module to see if we're moving in the right direction, and hopefully get the okay to start making some voiceovers for our first one of the antihypertensives and heart failure medications. Thanks, Matt.